The Marion Peckham Egan School of Nursing and Health Studies was awarded a grant of $1.2 million over 4 years from HRSA through the Maternity Care Nursing Workforce Expansion Program. Through this grant, we are working to increase the number of midwives from diverse backgrounds. Also through the grant, students will be immersed in evidence-based, culturally competent practices to address maternal health disparities. To do this, we're using the approach of trauma-informed care. We're able to increase the number of midwives to support birthing people and to confidently achieve healthcare goals while we work to eliminate maternal and neonatal morbidity and mortality, particularly for Black birthing persons.
Receiving the HRSA grant is very validating because it shows how important midwifery care is as a whole. It expands access to midwifery care.
Personally, the HRSA grant has already changed my life. It's lifted a huge burden off of me financially and made me even more excited to pursue this degree. And then more importantly for our patients, it's going to expand our workforce and make what we do and what we stand for more valuable and more known to the public. And I think that is only going to make huge changes in patient care and patient outcomes in the future.
This grant is a really great opportunity because as a person of color, I noticed that there are not a lot of providers of color in the field of midwifery or perinatal care in general. It is really important for people like me to have providers who look like them in order to feel safe during their birthing experience.
So to be a recipient of a HRSA grant means a lot because it provides financial stability. It helps me to really focus on my academics and it allows me to really immerse myself into becoming a great midwife. This HRSA grant really places providers in the areas where services are needed the most, and hopefully that'll help improve some of the statistics that we're facing, especially in the United States, but globally as well.
Our specific grant goals are to increase diversity within the midwifery community, to address and to eliminate the maternal health crisis, and to incorporate more trauma-informed care and implicit bias education for all midwifery students in the program. Through the grant, there are significant funding opportunities for students to cover a substantial portion of tuition and to provide an annual cost of living stipend. There's also stipends for our midwifery clinical preceptors. This grant is a 4-year cycle and will carry from 2023 to 2027. On the importance of expanding the pipeline and diversifying midwifery care, I feel strongly that how a birthing person is supported and cared for during their child's birth sets forth a cascade of either a positive or negative health outcome for themselves and their child. Notably, midwifery care has a track record of positive outcomes, setting the stage for improved health for all.
The HRSA grant has allowed for more midwives to enter the field of midwifery, and Fairfield will be able to provide them with the education needed to become successful midwives, like me and Susanna.